Hi, I'm Dr. Arjnur from Dr. Arjnur's OIT Institute. Today I'm giving an explanation on an OIT writing for doctors. See, doctors, first of all, we have to go at the end of the writing notes so that we should know who the reader of this writing is or to whom we are writing, because we have to select the notes accordingly. Here in this writing, the reader is an orthopedic surgeon and we have to select the notes accordingly. If I go with the beginning of the writing or the explanation of the writing, so the patient's name is Mr. David Taylor. He is 38 years old, married man with 3 children. First of all, it is very, very important to select the notes according to the problem of the patient and what we require from the doctor. We should go with all the notes and then prioritize the information by selecting the notes. If I go through the notes properly, he is a landscape gardener. It is his occupation, which is the major cause of his problem, that he is not able to do his job or his work properly due to this problem. He runs his own business, no personal injury insurance he has. So this means he has to pay the amount of his treatment by himself. Otherwise, he is an active person, enjoys sports. In OIT writing, we have to select the important information only and eliminate irrelevant information, because by writing irrelevant information, you will be unnecessarily expanding the notes and writing that information which is not required by the doctor to whom you are sending this writing. He drinks 1 to 2 beers a day, more on weekends. So this is irrelevant. We can easily skip this. Yes, this is very important. Smokes 20 to 30 cigarettes per day. Then his post-medical history, that is left inguinal hernia operation in 2008. Even an orthopedician does not need to know this. Our writing starts from this point, that 12, 8, 10. It is subjective that the patient first presented to me with left knee joint pain and swelling, difficulty in strengthening the leg, has history of twisting. It is left knee joint 6 months ago in a game of tennis. At that time, the joint was painful and swollen and responded to the painkillers. Finds injury is inhibiting his ability to work productively. Worried as he needs regular income to support family and home repayments. So, see students, when we are selecting the notes, we have to give the history that he sustained this injury while playing tennis game 6 months ago. And he started finding difficulty in strengthening the leg. And the patient, when appeared to me, at that time he was complaining of left knee joint pain with swelling. Now, it is objective what my findings were. On examination, he was found to have limb slightly swollen, left knee joint, tender spot on medial aspect of the joint and no effusion. Temperature was normal. His BP was normal, pulse rate was normal. So we can simply write that his vitals were found to be normal. Investigation. So this is my investigations which I ordered: X-ray, knee joint. The patient's pain was managed or maintained by giving painkillers, or he was advised to reduce smoking. That's the reason I told that this point was to be written: smokes 20 to 30 cigarettes. So this is first day's findings and first paragraphs, what we have to write in the first paragraph. Review if no improvement. In this case, the GP feels that his pain might reduce by taking painkillers or reducing smoking or taking rest. So this was important information to be written in the first body paragraph. Now come with the next. The patient visited after. So first was 12th 8. The second visit his was 25. So it is approximately 13 days, 2 weeks. We may write after he visited me after 2 weeks. At that time, the patient experienced intermittent attacks of the pain and swelling of the left knee joint with no fever. He was unable to complete all aspects of his work, and as a result, income reduced, smoking, whereas half of the cigarettes he reduced. Then objective, what was my findings or what was the GP's finding? As I am writing the letter, I am a GP who is writing this letter to an orthopedic surgeon. So my findings were no fusion was there, where swelling was found, tender on the inner aspect of the left knee joint, flexion extension was normal, impaired range of power or passive and active. Now, whenever there is question mark after diagnosis, this is suspected or the provisional diagnosis. So this is injury of medial cartilage. So I suspected him to have injury of medial cartilage. Now, investigation. First, on the first visit, I ordered an X-ray. Now, I ordered an MRI as I was not able to diagnose the patient properly by his X-ray. Now, what was the management? Again, the Voltaren was given to him and he was asked to come for a review after 1 week. When the patient comes after 1 week or after 10 days or after 15 days, we can say, so the limb was present, patient was anxious as he has been unable to maintain full-time work. So this is very, very important because the patient is not having any insurance and he's considered about his work. He wants to go back to his work and the GP is not allowing him to work because he is working as a landscape gardener. Being a landscape gardener, if he continues his work, his pain may go or may worsen. So here the patient is asked to take rest or to avoid doing his work. Then MRI report. This is very, very important finding because the MRI report confirmed his diagnosis of damaged medial cartilage. Now this is management plan. What is to be written in the last paragraph? It is he's being referred to an orthopedic surgeon, Mr. James Brown, to remove damaged cartilage in order to prevent further osteoporosis, and as the GP has already contacted Mr. Brown's receptionist and his appointment has been fixed via his receptionist. Now, if I have to write this letter, how would I respond to this? First of all, in the beginning, we may start it in any form that first is salutation, the date and the salutation is to be written, then Mr. Dr. Brown, dear Dr. Brown, then regarding about whom we are writing, this is David Taylor. I may give the beginning in 3 ways. First is, I'm writing to refer Mr. David Taylor, or thanks you for seeing Mr. David Taylor. Then about his problem. So what I recommend that you should give the purpose first. In the introduction part, we have to clarify 3 things. First, about whom we are writing. This is Mr. David Taylor. Why we are writing this is the purpose of our letter, that we want the further management. We want the patient to be treated properly. And third is what the patient is having, what problem the patient is having. Now, this patient is having damaged medial cartilage. So, he requires a treatment to avoid further osteoporosis. So, in this case, the GP feels that patient requires an arthroscopy to remove the damaged cartilage. Your beginning may be, thank you for seeing Mr. David Taylor for the removal of the damaged medial cartilage to prevent further osteoporosis. So this could be the introduction part. Now you should give in the first body paragraph the description about his medical history, or what the patient had complaints previously, what treatment the GP gave to him, what was the response to the treatment, and now in which condition the patient is being sent to an orthopedic surgeon. First body paragraph, that is to be written with the first visit of the patient. As this patient is not a regular patient at GP's clinic, so we may start that he first presented to me with complaints of pain and swelling in the left knee joint associated with difficulty in strengthening the joint. On 12th August 2010, we may write, Mr. Taylor first presented at my practice, at my clinic. If we are writing that in practice, the correct word will be in practice. Mr. David first presented to me, or first presented at my clinic, or first presented in my practice on 12th August 2010, complaining of pain and swelling in the left knee joint associated with difficulty in strengthening the joint. So this is the major complaint the patient first appeared. Now, what were my findings? So here, what I found the patient was having will be written like this, that he initially twisted his joint in the game of tennis 6 months ago. This was the cause of his problem, that he sustained this injury, or he had this difficulty, he had this problem while playing a game of tennis 6 months ago. He experienced pain and swelling which had responded to painkillers. So instead of has, we should use responded, because this was a happening of the past, and we should not write in the present perfect tense, as anything we are writing about the past is to be written in the past simple tense. So you may say that he responded to the painkillers. Now, this is a previous history of the patient, that how he got this injury and what was his reaction to the painkillers. Then now, examination, as this was to be done by the GP, or as I am GP at this time. On examination, he was found to have, or his examination revealed, a slightly swollen joint, and there was a tender spot in the medial aspect of the joint. Full stop. He was prescribed Voltaren 50 mg twice daily, or he was advised to take, you may write anything. Then come with the second body paragraph. So this second body paragraph is very, very important, as you have to give the reaction to your treatment, whether the patient responded to this, or what condition the patient came to you in the next time. So if I have to write, I'll write like, despite my treatment, or despite the treatment, patient developed. So I would suggest that you should write his name, Mr. Taylor. The second name is to be written. Mr. Taylor developed intermittent pain and swelling of the joint despite of the treatment, or despite of taking painkillers. He visited me with worsening of the symptoms, or in the same condition, or with no improvement in his condition. As we ordered an X-ray on the first visit, so we may directly write that his X-ray showed no evidence of osteoarthritis. No need to repeat the information again and again, as if you write in the first paragraph that he was ordered an X-ray, then the second paragraph again you are writing about the results of the X-ray. So it is suggested that you should directly say that his X-ray revealed, or the X-ray showed no evidence of osteoarthritis. However, now this is when we are writing in contrast, then however word or connector is to be used. However, the range and the power, including passive and active movements, were impaired. Therefore, again you should use a connector. Therefore, an MRI scan was ordered that revealed. So you can directly write the results of this, because if you're writing again and again the same things, it will unnecessarily extend the letter to the word limit, as we have to finish the writing within 180 to 200 words. So it is my suggestion that you should avoid any repetition. Simply you can go with the results of your investigations. So his MRI or an MRI scan revealed a damaged medial cartilage. So this was a major finding in this letter, why the patient is being sent to an orthopedic surgeon. Now, what is the action? What you want the orthopedic surgeon to do with your patient? We have already explained in the introduction part. Now you have to clarify this. As in this case, we have set an appointment with the doctor via his receptionist. We have to explain this thing. The patient felt mild pain, but the swelling was not reduced when he was examined in the morning today. Or today, the patient was found to have pain with swelling. Therefore, he is being referred to you to resolve the issue, as it is affecting his ability to work and support his family. See students, in this letter it is 3 times his income status is mentioned, as he wants to work and is unable to work due to his problem. So that's reason it is to be mentioned in the letter that he wants to start his work. So we can simply write that Mr. Taylor is keen to resolve the issue, as it is affecting his ability to work and support his family. Now, the last line, how we have to end up the letter. In view of above, I believe he needs an arthroscopy to remove the damaged cartilage to prevent further osteoporosis in the future. Or you may say that in view of above, he is being referred to you for further management, or in view of above, he is being referred to you for an expert opinion. His appointment has been set at 8 a.m. via your receptionist. So this is to be mentioned, as the doctor should know that he has an appointment with the doctor. Now, end up by saying yours sincerely, doctor, name of the GP. In this way, we can give the explanation of the writing for the best score. Select the important relevant information which is required to be known by the doctor to whom you are sending the letter. Do not exaggerate unnecessarily by giving his social history or anything which is irrelevant, and in this way you will be losing the weightage of the letter. Hope you will find this useful for your further practice of the writing. Stay connected for further samples, as I'll be uploading more samples of OET writing in my channel. If you want to have further information regarding this, please subscribe my channel and like and share this video. Stay connected, stay healthy and happy learning. Thanks for watching this video.